foramen, infraorbital foramen, it is opening in front, outside, and mean this nerve, it is coming from the orbit, the outside in the face. So here, this one is a infraorbital foramen. This is called by this one is a infraorbital canal. This is called by the infraorbital canal. And this infraorbital canal outside, it is communicated with the infraorbital groove. This is called by the infraorbital foramen. Infraorbital foramen. So this nerve, and it runs within the infraorbital, first it is in infraorbital groove, and then it runs through the infraorbital canal, and it comes out. Then it gives the three branches. This is a labial branch, and this one is called by the nasal branch, This is a palpable branch, This one is a palpable branch, palpable branch. This one is a nasal branch. This one is a superior labial branch. When it comes out from the inferior orbital foramen, immediately it is divided to give the three branches, and the superior palpable branch, and it supplies to the lower eyelid. And the nasal branch it supplies to the nose, and just lateral part of the nose. And the medial part of the nose, it is supplied by the external nasal branch, and that is a branch of the anterior ethmoidal nerve. And anterior ethmoidal nerve, it is a branch from the nasociliary. It arises from the nasociliary. That already we have discussed. In here, and this nasal branch, it supplies to the nose. And the superior labial branch, it supplies to the upper lip. Upper lip is supplied by the superior labial. Nasal branch, it supplies to the nose, outer aspect of the nose. And palpable branch, it supplies to the lower eyelid. So here, first you see maxillary nerve. Maxillary nerve, it is arising from the trigeminal ganglion. This one is a trigeminal ganglion. In the anterior margin of the trigeminal ganglion, it is giving the maxillary nerve. So on the anterior margin from the medial aspect, and there is a ophthalmic nerve that is arising from the trigeminal ganglion. In the lateral side, from the anterior margin, it is giving the mandibular nerve. Means the ophthalmic, in between the ophthalmic nerve and the mandibular nerve, and this maxillary branch, it is arising from the anterior margin of the trigeminal ganglion, and it is a purely sensory, and it reaches this cavernous sinus, posterior part of the cavernous sinus, and then it follow the lateral wall of the cavernous sinus, and inferior to the ophthalmic nerve, it leaves and when it reaches this anterior part of the cavernous sinus, and it runs forwards and inferiorly, and it leaves the middle cranial fossa, and it enters into the foramen rotunda, and it runs this pterygopalatine fossa, and in this pterygopalatine fossa, it is present inferior to the floor of the orbit, posterior to this maxillary body of the maxillary bone, and posteriorly there is a root of the pterygoid process is there, and at that level and between them, and there is a pterygopalatine fossa is there. This pterygopalatine fossa, it contains the pterygopalatine ganglia. So at this level and this maxillary nerve, and it gives the sensory, ganglionic branches. This ganglionic branches to the pterygopalatine ganglia, means sensory input from the maxillary nerve. The sensory input to the ganglia is getting from the maxillary nerve, and then it runs forward and inferior to the orbit, and it finds the hole. That hole is called by the inferior orbital fissure, and it enters into the inferior orbital fissure. Then on the floor of the orbit, it runs towards the anteriorly, and the floor of the orbit, it runs anteriorly. It enters into the here. There is a groove is there, and this groove is called by the infraorbital groove, and it enters into the infraorbital groove. Then this maxillary nerve, it is called by the infraorbital nerve. From here to here, it is called by the maxillary nerve, but when it enters into this groove, and it is called by the infraorbital nerve. So infraorbital nerve, it is present in the infraorbital groove, also it is present in the infraorbital canal. So here, it enters into the infraorbital groove, it runs forwards, and this groove is converted into the infraorbital canal. Some layer is there, the layer, and that covers that, and it is converted into the infraorbital canal. Through the infraorbital canal, and this maxillary nerve, it runs towards anteriorly. It comes out through the infraorbital foramen. Immediately it is divided into the palpebral branch. Palpebral branch, it supplies to the lower eyelid, and the nasal branch, it supplies to the lateral part of the nose. The middle part of the nose is supplied by the external nasal branch. That is a branch of the anterior ethmoidal nerve. And then it inferiorly gives the superior labial branch. It supplies to the upper limb.